welcome to Peninsula Vet Emergency and Referral Hospital podcast series.
This is a first for us.
It is, absolutely.
Yeah.
We actually have absolutely no idea what we're doing.
We're just winging it.
I'm trying to read from a piece of paper, be quiet. Anyway, what's the point of this? We just thought we'd give it a go, talk about anything to do with vet, maybe not talk about vet either, relationship advice, I don't know. You know. But today we are going to focus, and I have us across the very fine table, Alison Stickney, medicine specialist and partner in the business, and I am Arthur, surgical specialist.
Dr. Arthur House.
Thank you. Also a partner in the business, and a little about me. Yes, where do you start with all that? I've done surgery for a while, a long time now, and in all sorts of hospitals in the UK and in Australia. Worked for people, worked for myself, made a business, done all sorts of different types of surgery, had a little bit of an adventure along the way, keep having adventures, always get myself in trouble. It's what I do. But Alison is probably smarter than me. What do you do?
Well, similar to you. I mean, I've become a specialist, become a business owner. Very similar career, I think, to you. So I guess a little bit about my background. I started in general practice, in rural general practice, so lots of on-call, lots of working it out as I went along, and then did some emergency work and decided very early on that I wanted to specialise. So sort of started to work towards that from, probably 6 months after graduation. I realised that GP wasn't for me. So did a master's, did my memberships, got a residency, fell into a PhD and finished that along the way. Sat my boards, ACVIM boards, and then did a little bit of private practice with Arthur. That's how we met back in the day. And then we both were integral in starting up, contributing to the development of PenVet.
Do you remember that coffee?
I remember a lot of discussions.
Yeah, we went and had a coffee and I said, there might be an opportunity on the peninsula.
And interestingly, I'd contacted the peninsula independently thinking, this is a good, maybe.
Fun.
So 6 years ago now, we came on board. Well, you came on board a little bit earlier, but the emergency referral hospitals opened up about 6 years ago. So it's been a really great journey.
Now, we have to focus.
We do.
We're not good about it. So so the title today is How Do I Get to Where I Want to Go? And I'm to blame for that.
It's a great topic though, isn't it? Because I think in our current role we are constantly offering advice and lots of junior vets coming to us saying, hey, I want to do this and I want to do that. And, you know...
Well, that's the whole thing. I mean, that was sort of why you and I ended up doing what we've done, is that we think quite similarly, and we've had a lot of similar experiences with regards to, we both had an academic career initially, and we both feel really strongly about the future of the veterinary profession and giving people an opportunity to succeed. And we've had to counsel. I've lost count. I've been asked that question of how do I get a residency that many times, but there obviously isn't a great answer to that. So maybe you sort of mentioned what you did, but you know, what were the steps that you followed for that?
Yeah, so I mean, I think we'll probably talk about this, but there are sort of two pathways to getting a residency, and I did not do an internship at all. And I think that's very rare these days for new specialists. But I very much went along the pathway of getting lots of experience as much as I could in general practice and then emergency, and ticking the boxes with further study to improve my CV and chances of getting a residency. So I started with a master's by coursework through Murdoch Uni, and just really tried to become as good as I could at medicine quite early on. And the emergency work was a really great way of seeing lots of different cases and developing those skills. and then started to apply for residencies soon after that. And that was kind of when I was already on so I was, 5 years out, already enrolled in my membership with the Australian College. Hadn't sat memberships, but was planning to, and applying for residencies along the way.
Yeah. Mine was similar. You're much smarter than me. Mine was very sort of a little bit
Well, it says you
erratic.
with a PhD as well. Like, come on.
Yeah. But like there was I was never great at planning. Like, my wife Jackie and I were in the UK. I'm digressing.
That's
for
okay.
like 13 years, and we basically woke up one morning at 12 years, 6 months, and said, "Why are we still here?" Like it was like we're still in England.
Yeah.
And Jackie was like pregnant with twins. And it was like, oh, maybe we should go home. And then we ended up in Melbourne, not Perth, but hey. So that's me. Like randomness is what I do, but I have made my own luck along the way. And certainly, so I like you, I did general practice. I actually did mixed practice. I was really bad at it though.
Yeah.
So like, I remember trying to do a cesarean and the other vet coming along and just saying, "Why didn't you go make the tea?" Which is like really embarrassing, hey? And I sort of grew up on a farm, so that's humbling. Anyways, and then I was in Perth and just south of Perth and having a bit of fun. And my boss was I owe a lot. Shout out to Peter Adamson, Malibu Vet Clinic, because he'd gone to the US and done an internship in equine, but he always encouraged me from the first day of my practice was to endeavour to get a diagnosis and to not just give out prednisolone and Clavulox and to give things a go, but to always pursue cases. And I have carried that with me throughout my entire career. Don't get stuck in that, it's too expensive or I don't have an answer. Search, inquire and search for answers.
Yeah.
But I realised pretty quick that I like doing surgery.
Yeah.
Had no idea how to get there.
Yeah.
And actually, one of my experiences, which I promised myself wouldn't do to anyone else, is I was going to a local university to get experience and turning up to case rounds and all the rest of it. And my brother was in the US and he's a large animal specialist. He was at Davis. And so I thought, I'll go to US and I'll try and get a residency. So I spent 7 weeks in the US, went to Davis, went to Colorado State, went to anywhere who'd say hello, and thought about getting a residency and put in an application. And there I was, no idea, like really junior, no postgraduate qualification to speak of, no experience to speak of. And in about 6.5 weeks into that journey, I had this crushing sort of realisation that someone should have said to me, "You're never going to get it this way, that you should have applied for an internship first."
Yeah, and there's the match in America too.
God.
So it's like
Yeah, but
such a process.
The lesson was that it doesn't take a lot to pull someone aside and say, "You're going about it the wrong way."
Yeah.
And that's partly why I'm motivated to talk about it, because there I was putting all that effort in and just making a fool out of myself. And actually one of the residents that I met along the way politely tried to say to me, "You're doing it the wrong way," but they were too polite and I was too fixed on a journey.
I'm sure you made some contacts though. Like the networking was,
I guess so.
probably,
Yeah.
it's all a journey and experience, isn't it?
Yeah, I saw what I wanted to do too.
Yeah.
I saw some amazing stuff, people doing vascular surgery, and it was early on in intrahepatic shunt work, and some of the world leaders were there, and I got a lot of exposure. But I didn't have anyone mentor me, and that was sort of meant that I had to redo a lot of stuff that that I could have done an easier way straight up.
Yeah.
But from there I realised that Australia couldn't accommodate. There wasn't really me, but there weren't the programs.
It was too small.
Yeah, too small. Thanks. And so I went to the UK and then followed a path like yours. So I did a certificate, which is like the membership.
Yeah.
But I spent a lot of my own time at a local referral hospital.
Yeah.
And then that's how I managed to make the contacts with specialists to actually get to meet people and to chat to them about what were they looking for.
Yeah.
And the UK has this beautiful... It's really good actually. So amongst the surgeons, there's two big societies: the Orthopaedic Association and the Soft Tissue Association. So BVOA, British Veterinary Orthopaedic Association, AVSTS, Association of Veterinary Soft Tissue Surgeons. Bit of a mouthful, but they have these conferences twice a year. But the really good thing there is, as a junior vet, you could go and basically get continuing education, but be sitting right next to the specialist that might one day offer you that residency.
Yeah, and making contacts and networking. Yeah.
And we don't really have that in Australia, unfortunately, to the same extent.
Mm.
But those who actually worked for the specialists too, because they got to see all the different people that were out there looking for these positions. And for you, it gave you access to sort of be noticed as such. Yeah.
I mean, that's a common thing though, isn't it, with both of us? We put in a lot of time. We're both working full time.
Yeah.
There's a lot of, I did mine through formal study. You did yours through more placement and networking, but lots of time outside of work trying to get where we wanted to go.
Yeah. I mean, I was spending a weekend every 2 months at a continuing education event. Pretty well. And I used to start work on Wednesday at 4:00, and then you'd do the night consulting, and then you'd actually stay at the practice overnight. That was the on-call system, that big old Victorian terrace set up. Upstairs right on the
flat,
roof. Flat. And so I'd go and spend time up the road with the specialist, and then I'd be running late to get to work because I've been scrubbed in at surgery all day. So lots and lots of extra on top of work. But I think you'd probably agree if you want to pursue these specialist options or advanced education, you have to have a passion for it. It can't be something that you think might be a good idea. In fact, it has to become all-consuming.
It does, and I think it's because it is all-consuming, isn't it? It's really your life for a long time. And I get worried when younger vets come to me, or students even, I want to specialise, I just haven't quite decided which discipline. But without that passion for a particular discipline, I think it would be hard to devote the amount of time and study to get to that point of specialisation, thinking, I might do this. I get that, people just want to specialise, but I think without that passion, it's a lot harder road.
But why do they just want to specialise? Because for me, sometimes, you would have had this too. See, I've had so many comments along the way. Some of them you just think, really? Like the classic is, I wanted to become a surgeon, but I wouldn't take the pay cut to do the internship. And you're like, dude, there's no way. You weren't going to make it. Or I wasn't prepared to move. I was prepared to cross the world to get a residency. I went to the UK with the intention of trying to get specialist training.
Well, I was similar. The residency in New Zealand came up at Massey, and it really was quite lucky because I just saw the application and I rang my husband and say, hey, you want to go to New Zealand? I've just had an interview and I think this is real. I didn't have kids at the time. It was easier, but we sold our house. 7 years we spent in New Zealand, and like yourself, you moved your wife and
girlfriend
moved your whole
at the
life.
time. Well, not even quite girlfriend. We were on a break. But because she said she was going to England, I had to go too.
She was going and you
followed.
Well,
we both were. We were sort of having an England off, if you want to call it that. Yeah. And ultimately said, why don't we catch the same plane there? I think by the time we landed, we were back on again.
You weren't on a break anymore. Anyway. But that's the point, isn't it? It's my husband left his job and yes, this was it. This was my chance.
And I think that's worth talking about is what does specialist training mean to your partner?
Yeah.
And Jackie, you're out there somewhere. I owe you a lot. She knows that. Jackie once said to me that she was basically a single woman for 4 years.
Yeah.
And there was a bit of red wine in amongst all that.
Well, my husband learned to run and cycle, and he went tramping in New Zealand a lot because every weekend.
Tramping?
Yeah, you don't hike in New Zealand, you tramp.
When I think of tramping, that's like on cardboard on the footpath with an empty bottle next to you.
No, not being a tramp. No, he spent every weekend doing his own thing, and we renovated a house. That was his thing because I was studying.
Yeah.
That's all I did for, 4, 5, 6 years.
Yes. Well, see, I'd go to work and get home at, I don't know, whenever, 8, night time. It was dark, but it is England, it's often dark. But then I'd have to write up my referral letters.
Yep.
And we used to do it on dictaphone. Yeah, I am 80, yes. Yep. Anyway, so because, you have to socially engage with your, She was, actually,
Wife.
she was a wife by that stage. Yeah.
Yep. You
So
have an
we
obligation.
drink red wine. I'm not an alcoholic, but I can be if you want me to be.
You can write referral letters with a glass
Well,
of
I
wine.
used to
That's
on dictaphone.
perfectly acceptable.
But the thing is, that as the bottle got emptier, the referral letters got more random. Here's the question I've been asked, and I'm wondering how you answer it. So here's me. So I'm like, how old are you when you graduate nowadays? 20?
Oh, 21? 21? When you graduate?
I think so.
Yeah, 20.
I was a bit older, but anyway. Let's say you're in your early
bit
20s,
slower.
so I'm not so sure. And you've done a couple of years in practice, and I'm now saying to you, hey, Alison, I want to become a medicine specialist. How do I do that? Can you answer that? And then if you can, what do you tend to say to people?
Yeah, so I think these days you really do have to do an internship. There are not many, there are the odd institution that will look at candidates without an internship, but I think the rotating internship is a little bit optional, depends on how much experience they've got. I think rotating internships are very good for very recent grads or even new grads. For someone with a few years of experience, I wouldn't necessarily think they'd need to go down the rotating internship path. But the specialist medicine internship, I think, is useful for to really find out if that's what you want to do before committing to residency as well. So it's almost more for yourself as much as actually getting the residency. So you get experience, it goes on your CV, you network and you get to know specialists and it opens doors, but you also get a really real taste of what referral practice is like, because I think unless you've worked in referral practice, you may not realise what it actually entails, the sort of caseload, the sort of workload, what life is like after specialisation, because you do all this work, you get through your residency, you sit your boards or your fellowships and you pass and you're a specialist, but it's still a hard job and you're always learning, you're still doing long hours. The pay gets better, but it's probably not what, it doesn't pay back all those years of...
So we're both business owners, yeah? And I think, I'm going to stop you there for a second, I've got two questions. I think that's really important, is that increasingly there's a little bit of a problem. I'm a surgical specialist and hence I'm worth this much on my salary. But unfortunately, yes, you get paid more, but just like being a general practitioner or any walk of life really, you're not paid just because you're a specialist surgeon or a specialist medic. Your pay is reflective of how hard you work and turnover and how you contribute to the business in general. So it does seem to me we're starting to get to a point where because I'm a specialist now, I should be paid this much without a connection to the ongoing hard work. Like basically being a specialist, it's tough doing all the training and all the rest of it, but the tempo of your work is high, particularly if your expectation around salary is high. So,
well, that's right. And I think, there are expectations to generate an income, a good a good caseload as well.
But it's equally sort of tough, isn't it? Because you've done all that work to become a specialist and you're sort of like, well, I deserve it now, which hey, that's fair. But you have to be really careful with that. So when people, I'm now very happy to discuss with someone thinking about that pathway of specialisation about, well, your expectation around pay in this discipline is about here. It's not just limitless. It's only, it will grow if your caseload grows. It will grow if you decide to be a business owner. But you can be a business owner as a general practitioner. You don't have to be a specialist to do that.
Yeah, absolutely.
So if people are very financially motivated, to be honest...
Oh, you don't specialise for the money.
No.
In vet.
Well, you would have done better setting up a practice 4 or 5 years earlier.
Yeah, absolutely. Because there's also that years of lost income.
That's right.
Because as a resident, you really don't earn, let's face it, not much more than a new grad. It's a training program.
Well, I was on £13,000 a year.
Yeah, I was on a scholarship. Like in the academic ones, it's a stipend for the majority of. So you really earn hardly anything.
Wow.
In private practice, you get a bit more, but it's nowhere near what you'd earn for your level of expertise as a general practitioner. So there's years and years of income sacrifice. And then you become a specialist and yes, the pay goes up, but you still have to work hard for that.
Yeah. And those two questions, so just to clarify, rotating internship is where the program is set up that you go through different disciplines, and a specialist-specific internship is where you just stay with
that's
that
right.
one discipline.
So if you know you want medicine and you've had a couple of years in general practice, some institutions will still expect a rotating internship, but a lot of them in Australia would consider you for a specialist internship. So, you know you want medicine, you're just going to go straight into experiencing referral medicine. Whereas if you're a very new graduate or recent graduate and you don't know, do I want to do medicine? Do I want to do ECC or surgery? The rotating internship gives you a taste in a supported manner, but you're not committing to one discipline.
Yeah. So my journey, again, I didn't do an internship either. I actually, as far as I'm aware, was the last person to get into London to get a surgical residency without an internship. So everyone after me had done at least an internship. And some internships and PhDs. And there was a really, my time in the UK, so I started residency in 2000 and left in 2009. So there was a quantum shift. So the old school resident applicant was someone who actually had experience, because the supervisors were looking for someone who could work on the shop floor as such from day one. And then the shift has been that they wanted an uncompromised and untainted mind. So
do you think that's the reason, or is it just more competitive? So the internships are a way of bolstering the CV? Or do you think the program directors are actually wanting that young blood to mould?
Well, there was a bit of snobbery around, if you've been in general practice then you're tainted.
Yeah, right.
But I don't know if that... I don't think that was a conscious decision,
It's a shame though, isn't it? I love taking interns that have had experience.
Yeah, absolutely.
And you can help them develop that and become really good clinicians. And, and they're even the ones that don't always go on to do a residency because they're like, oh, actually, I could do really good work in GP.
Yeah. No, and I'm one of the tainted ones, and I think I did okay. But hey,
mixed practice. So you were ruined from the start.
Yeah, obviously. But then Australia, we still have both streams. It feels like, and so when people ask me what I do to get a surgical residency, I'll say, well, unfortunately, I can't give you the answer because there isn't one, because the programs all vary. So many of the private practice residencies, they need a level of experience so that you can basically get out there and do surgery early on, because it's an economic decision, it's a business decision. Now, I can tell you, being a business owner, that residence is you have to want to take residence because you want to train people. There's no value in taking residence purely for the business profitability, because it doesn't work. Because the time taken to supervise those residents is time that you're not cutting cases yourself. Yeah.
It's very unprofitable, isn't it?
It's a break-even exercise, really.
Yeah, but it's a big commitment to take a resident.
Well, that's right too, because if anything changes, it's a 3-year commitment, and you can't just, you shouldn't.
Well, you can, but
you shouldn't just leave them.
That's
and
right.
that unfortunately does happen to people, so be aware of that. They start a residency, something happens in the business, and then there's no residency available, and they might have committed 2 years of their life, and then you are really stuck, and that's very sad. But there are the two different types of opportunity in Australia, in that there's the person with more experience, so they may be, nowadays you would need an internship of some sort, but you've got memberships and you've had time in general practice, and you've sort of had an interest in surgery for some time, and maybe you were the lead surgeon in a general practice group, then you do your internship, and then maybe you get a spot. And then there's the more classical, which is the UK and the US system, where you're undergraduate, internship into residency, often in the same academic institution, so you go from one to the other. So it is hard to advise, isn't it? Because it really depends what that individual's looking for. And in my mind, what you have to say to them is, well, where are you looking at going to, and find out what they want. And you may not fit. You may not be able to go to this academic institution because you're 8 years out of, you've been out for 8 years, and they don't look at those sorts of people.
And I think if you're one of those people, you really have to network and make contact with people in the institution and really talk to them. and let them know that you're out there and you've got your memberships and you're good and you've had experience. But you need to target those people and really, get to know them and see what they want.
So you're just talking about like building those relationships, and that's a piece of advice I certainly give.
Yeah.
Is one of my supervisors said this to me. He said, Arthur, a residency is like a marriage, but you don't get to choose your bride or groom. And I was like, yeah, that's fair enough. But it is. It's like it's a really intense relationship, and it's this weird sort of working relationship that certainly doesn't fit within Australian working laws.
You make it sound really dodgy.
No, but it is.
It's true. Yeah. I mean, the residents I've trained, the relationship's very close, and it's almost, some days you feel like their parent.
Yeah.
Like it's really, you're mentoring them, you're their boss, you're their friend, you're their mentor, you're their teacher. It's an interesting dynamic, isn't it?
On that note, though, that intensity of the relationship, which can't be avoided, does mean that getting to know future employer or future provider of residency is so important, because you can be brilliant, but if you can't get on with that team, it's a disaster. Like, it's such an intense relationship, it's such an intense time of your life that if your supervisor and you don't gel in some way, or, you have to be able to get on, then it's never going to work. So the truth is, for me, and I'm sure for you, when you're selecting your next resident, how they fit in with your team is a huge part of the decision.
Well, it is. It's a big part of the selection process, isn't it? It's not just what they've done and how good they are. It's who they are.
Yeah.
But the same goes the other way. I mean, if you really wanted a residency and you were offered one, you'd be pretty brave to turn it down, because you probably wouldn't get another one.
Yeah.
But if your potential supervisor is someone you really just don't gel with, or they're not interested in taking on a resident, you're committing 3 or 4 years of your life, and if you're not getting a good education, you may not make it in the end. So, it's got to go both ways.
I find that one super difficult, because I've had more than a few people in that circumstance who come and talk to me, their residents, they're really struggling, they're really unhappy.
Yep.
It's not working out between them and their supervisor, but I tend to say to them, don't forget that the residency represents the beginning of your specialist life, not the...
Absolutely.
It's not defining... You don't end your residency and go, now I'm a specialist and everything's done.
No.
You go, oh, I actually don't know anything really. I feel very small.
Yep.
And oh my God, I've just realised how little we understand all this.
Yep.
And now I'm going to spend the rest of my life trying to get better at it.
Yeah. And there are ways of, if you're in a residency that's not feeling good, or you're not getting a decent education, you can look for other mentors. And they're not your direct supervisors. They may not be your boss, but there are other people that can help you through that process.
Yeah, sometimes just your fellow residents.
Yeah, absolutely.
So to build those relationships, there's one thing I definitely say to people is you need to visit. You definitely need to visit the institutions.
Yep.
But if you do, don't go for a day. That's a waste of time. You have to go for, really, I think, at least a week, so people get to know who you are.
Yep.
The other thing that, and this was a great piece of advice from the person I used to visit, I felt very small in the world of veterinary, and I certainly didn't feel like I was someone who could deserve a residency. And I was very reluctant to tell people, hey, I'm looking for a residency. And this guy said to me, Arthur, if you don't tell them, they won't know. So you're just going to have to go out there and say to people, I am looking for a residency.
Well, that's probably that fear of failure too that so many of us have.
Yeah.
That if you put yourself out there and you don't get one, everyone's looking at you. But no, you do. You have to tell people, because they don't know unless... And if someone is not telling me they want a residency, I'm going to assume they don't.
Yeah.
Or they don't want it bad enough. The other way to build that relationship is via email. So, if you're in practice, if you're a GP, perhaps you've gone and visited for a week, keep that relationship up by, contacting them for case advice and just, or even career advice, just to keep up that relationship, keep make sure you're in their mind so that when those residencies come up, they're like, oh, what about such and such who visited last year? I hear from them all the time. They're clearly interested. They want to advance their skills. And you're there in their face when those residencies come up.
Yeah, and absolutely. The other point around the relationship building, obviously, is CPD events. But I think you have to be very, you have to have a plan around that. So there's plenty of CPD events. Like an online CPD event doesn't build a relationship.
No. But even big conferences, you're just a face in the crowd, aren't you?
Yeah.
Unless you go up and talk to them.
That's right.
You know, like the morning tea.
Yeah.
Go and it's scary. Like it's hard to walk up to a specialist or whoever, especially if they've been speaking at a conference.
Yeah.
But it helps.
And you definitely need to do it.
Yeah.
I think the best events are, say, 2-day courses where you basically, you're in a lecture theatre or in a prac session.
Yep.
And you end up talking anyway.
Yep.
But you get it's that time thing, isn't it? You get enough time to get to say, hey, I'm interested.
Yep.
And for most of us who are the educator, the person who offers the residency, will take notice of someone once they say to us, hey, I'm interested.
Oh, absolutely.
Because obviously from our perspective, we're looking for the next potential resident. We want the candidate that fits into our hospital, who's we perceive as the next best fit.
And we sort of want to taste before we buy somewhat too, don't we? If we get to know people and know that they're a good fit, we're much more likely to consider them.
Absolutely. Right. Yeah. Another topic. The ones who don't get the residency. Now, they can either be, in my mind, the sad story or some of my best achievements as such.
Yeah.
So where am I going
and
with
that really depends on how they choose to go, doesn't it? Like make the best of a situation that wasn't perhaps what you'd planned.
Well,
versus striving for it for the next 10 years and never getting there. They're the sad cases.
But for us, on a personal level, with our new grad program and our internship systems, we've already had this, and I certainly saw this in the UK, where we've had candidates who've come along and done that early stage of that career progression heading towards a residency, and then they've recognised that it's not for them. They've dipped the toe in the water, they've had a taste of what it is to be a specialist, and they've gone, you know what, I just don't want to make that level of commitment. But they're really happy with that outcome, and they've put to bed this idea that I have to be a specialist. So they no longer wonder, they don't spend the rest of their professional life feeling disappointed.
And isn't that the benefit of the specialist internships?
Yeah.
Whereas, you and I didn't do them, but it really does give them a taste of what it's like and a window into the future and to see if they actually want that or not. And, I've two of my best successes are interns that went back into general practice who are doing great stuff, and they email me all the time about cases. There are obviously some limitations of what they can do, but they're really doing great work in general practice. And,
But the limitation, that's something that I also feel very obliged to talk about to people, is that in the surgery world, sometimes it feels like success is measured in how many different procedures you've done. And I think that's a really bad way to look at what you're doing. I think there's huge professional satisfaction to be gained by being really good at a reduced pool of procedures rather than average at numerous procedures. And all the people I know who've followed the course that I followed, so spent time in GP, got certificate/membership in GP, then became the head surgeon of a GP network. Nearly everyone I know who's done that path realised at some point and had a much happier life as a consequence. There's things you just don't want to do, and there's things that you want to do well.
Yeah.
But doing things badly was awful. So so going back into GP, having done an internship, for example, in some regards, it's a really good spot to be, because you've seen the level it takes for certain cases to be managed, which is not appropriate or available in the GP setting. And you're really happy to let them go because you don't feel like you failed. But then you get really good at the stuff that you can do within the remit of the circumstance you find yourself, and feel super satisfied with how well you're doing those cases.
Yeah, because it becomes less about ticking the box, I can do that procedure, and more about I can manage that case. And it involves a procedure, but I know when it's correct and the right thing to do, whether I should be doing that procedure, how to do the procedure, what to do with those results, and then how to manage that patient. So you get a much more holistic understanding, and you know your limitations, and you know when to refer. And
so the sad stories, the ones who didn't make it.
Yep.
And this kills me. This is the one that I have had a few of these over the years here, and they've done everything but not quite made it.
Yeah.
And why don't they get a residency? Who knows? Maybe they just didn't fit. The opportunities didn't turn up for them. They always just got pipped at the post.
Yep.
But one of the common observations is you have to be happy in whatever you're doing on that journey, because it will take you years. And if you're not happy doing the activity or the employment or the decisions you're making to try and improve your CV as you go along, it seeps out of you.
Well, you just become bitter because you're constantly filling in time until you get that residency.
Yeah.
And it's all about the residency. And then if you don't get there, it's like, well, what have I done? Whereas if you're, I don't want to say a plan B, but you do have to be doing something fulfilling while you're waiting. I agree.
Yeah.
Yeah.
Absolutely. So here's our summary. How do I get where I want to go? This is with reference to getting a residency. Priority number one. What's your priority? What's the first thing you have to do to try and get a residency?
Networking.
Okay, I put be happy in whatever you're doing. You say networking. Okay, number two. For you?
A plan.
Networking's number two for me. 3? I've never had a plan, so that doesn't even get on my list.
Yeah, I know, but
number 3?
Yeah, I don't know.
Come on. Can be more specific.
Yeah, well, an internship, I guess.
So I would put, nowadays I'd put internship 3.
Memberships.
I'd put memberships 4. 4
if you're in Australia.
Or maybe, or certificate
elsewhere.
or whatever. Postgraduate. And there's also the masters and all that sort of stuff.
Yeah.
So I'd put that pretty high because that's sort of concurrently. But I like to put that in, so 3, 4, 5 and 6 is every year improve your CV in one way or another.
Yeah, that's a nice, because it feels like you're achieving something along the way.
That's right. And you can take that with you even if you don't get there. Yeah. And maybe you go, oh, actually, it works for me. I'm actually going to settle in and be a surgeon for a big GP network. That's cool. Or medical, whatever.
Yeah.
Do you have another one? That's getting low on the list.
Getting your name on a paper, I think, is really important.
And we haven't talked about that.
We haven't, but if you can, even a case report.
We could do that as another podcast. How the hell to get a paper published? That's a nightmare.
That might help me.
Get yourself involved in some sort of clinical
because by doing that,
activity.
you're also networking at the same time, because you're not going to write it by yourself. So you're probably going to have a specialist or an academic or someone on the paper. So you're working with them, you're getting to know them. It's two birds with one stone. Yeah, I think you have to be personable. Even if you're shy, you have to get yourself out there and really communicate as well as you can and show people that you're a team player.
Yeah. And be brave enough to tell people.
Be brave
that you
enough.
Want it.
Yeah.
Absolutely. All right.
Be humble. Be humble. I don't like people.
Surgeons.
Yeah, I know. So, but like, recognise that you're very early in the journey, and that.
Yeah, but that would just come under team fit because
would.
You're not going to get a job if you think you already have the answers.
No.
What's the point of going through a process of education if you believe you're already educated?
But that's the thing. If you're really sometimes you're top in your GP practice and you've done all this extra study and you're like, but you're really just starting your career in terms of specialisation.
Yeah. We do hope that today was useful, not just a whole lot of rambling. But anyway. We'd love some feedback. This was the first time we've done it. That's why it's a little rough and all over the place. And Alison and I, our preparation was a conversation 5 minutes before we started. So there you go. Maybe we should do more homework next time.
We could. But we'd also be really interested in hearing the sort of topics that you want us to talk about.
Excellent. And you can email us at education@penvetreferral, no S on the end, and double R.
1 F, 2 R's.
.com.au. Thank you.
Thank you.